Okay, back again. Now I'm going to start on another section of the syllabus, and I'm still, however, talking about the constructs. And psychologists use the word construct to talk about multidimensional, complex ideas in a field. So we just finished talking about the construct of fluency. What is fluent speech? What is fluent language? And so that's one side of the coin. Now what I would like to do is to talk about the other side of the coin, and especially that side of the coin that you will be treating, namely the disruptions of fluency. So here, one of the main things that you need to learn is that there are normal disruptions of fluency, and then there are so-called atypical, or if you will, abnormal disruptions of fluency. So normal disruptions, or what we call typical disfluencies, include your fillers, your pauses, such as that. And even word repetitions can be considered typical disfluencies, because who doesn't from time to time repeat a word? Like, that was a filler. I want vanilla ice cream. That was a word repetition. Revisions, we all do that from time to time. I want vanilla, no, make that chocolate. That was a revision. And the reason that revisions are considered a disruption of fluency is because I changed my mind. And when you change your mind, and then your language and your speech, there was not the onward goingness of the message. So revisions are an example also of typical disfluencies. Parenthetical remarks is another example. And what parenthetical remarks means is that are exemplified by phrases such as, oh, by the way, that was a parenthetical remark. In other words, it's a phrase that is in parentheses, if you will. It does not convey new information. It is just something we say in passing, parenthetically. Now, even though these are typical disfluencies, I want you to mark the idea that some of your clients who actually have disorders will have typical disfluencies. And namely, these are the kids who have learning disabilities. These might be the kids who have language disorders, okay, as opposed to motoric disruptions. So that's normal disruptions or typical disfluencies. Then you can also have atypical disfluencies. And the reason we call them atypical is that no typical speaker will show these kinds of disfluencies. So, foremost is the disorder of stuttering. These disfluencies are atypical. So, no one actually would have a tense pause unless you are someone who stutters. Okay? So, for the most part, atypical disfluencies belong to the realm of stuttering. Now, keep in mind that life is not just all either black or white, either or. You will have clients who will have both typical as well as atypical disfluencies. And in fact, your project, whereby you have to do 2 fluency samples on some kind of client, some kind of speaker, will have probably both. Okay? So that's the larger picture of disruptions of fluency. So now let's talk about the classic disorder of disfluency, namely stuttering. Okay? And stuttering is composed of hundreds of symptoms for even one client. actually. So that if you were to analyze their speech, analyze their language, you could count 20, 30 different types of symptoms. So, since we're right now laying down the foundation, the infrastructure for the construct of stuttering, what could I say would be the essence of stuttering? What is at the heart of stuttering? Okay, well, I can offer you like about 6 or 8 essences, if you will. And it's like the metaphor here, the essence of vanilla, the essence of, the heart of whatever you're talking about. So, one good thing to keep in mind about the essence of stuttering is that it involves intramorphemic disruptions. Intramorphemic. So if you take apart that word into its component morphemes, okay, intra is within. Morphemic comes from the word morpheme. So within a morpheme, within a word. So the idea here is that the disruptions are within a morpheme or word. So the word baby is a morpheme. It's also a word. And if I have disruptions within that morpheme, baby, 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 any of those variations will constitute intramorphemic disruptions. Another essence is that stuttering comprises sound and syllable repetitions. Okay, sound such as sound repetitions. Syllable repetition is baby. Okay. Now, also prolongations. Baby. Okay. Now, at this point, if you were in front of me, I would ask you to simulate maybe a prolongation that is perceptually more severe. It's still a prolongation, but how do you make it more severe? I'm giving you a little time perhaps to simulate prolongation and make it more severe. Were you able to simulate one? Well, here's an example. Baby. All right, as clinicians, what did you perceive? Well, I simulated vocal fry. That tells my ear, your ears, that there was a lot of tension here. Okay, so it's not the same as baby. Okay, and even if I didn't have vocal fry, if I said baby, okay, I had a pitch rise. You know that there was something going on there that reflected discoordination. Okay. Another very, very useful idea to keep in mind about stuttering is that it involves some degree of physiological tension, physiological effortfulness. It's effortful speech when I go baby. It takes effort. It doesn't flow like Obama's speaking. Okay, so effortfulness and tension, and probably because there's this degree of effortfulness and tension, that there is some degree of discoordination. Okay, somewhere in your speech production system. It could be at the level supralaryngeally of your different speech helpers here. It could be the coordination between articulation and phonation. In fact, that is where the action's at for so many of our stutterers. Okay, but baby. Okay, there I exhibited discoordination phonatorally and articulatorily. Another good idea, helpful idea to keep in mind is that, at least for severe stutterers, severe stuttering, there's a sense of loss of control. Okay? And earlier I talked about maybe driving a car faster than you should on icy roads. Okay? You lose control of the car. In fact, maybe the car itself loses control. It skids on that icy pavement. So there's that sense that there's that loss of control. And in fact, it is the case that some people who are very severe in their stuttering, they don't even know what's going on as they're going through a severe block. It could be head jerk and eye blink and maybe even limbs moving, and they have no sense. They're just so trapped in that block that, and they're trying to get out of it, that they lose complete control and even awareness of all the myriads of behaviors that go on. So there are obviously then all these myriads, array of behaviors that stutterers show at the speech production system level, the secondaries, meaning the non-speech level, like the hands waving or the head jerk or the eye blinks. So to kind of summarize this construct of stuttering, I want to bring in someone who's really, even to this day, there's no one who was more brilliant in the area of stuttering than Charles Van Riper, who himself continued to be a severe stutterer to his deathbed. I know that because he wrote the foreword to one of the books I wrote, and he indicated that he would be glad to write the foreword, although he may not see the next spring. He had congestive heart failure. So we're still quoting him. He's the guru of stuttering. At one point he said that stuttering occurs when a word is improperly patterned in time. Okay? So key words there are that our speech has to have patterns. You and I have fluent patterns. The stutterer, the clutterer does not have very fluent patterns. So pattern's a key word, but it's improperly patterned. But then the other idea that's important is time, because speech is the ongoingness of gestures and words in time as a function of time. So improperly patterned in time. So this is not, terribly astounding to you. However, the next piece is just as important. And as I'm getting into the 4th decade of my professional life, I'm thinking that this is more and more important, which is that stutterers really have a great deal of psychological reactions to how they speak. And I'm convinced now that if you're working with adults who stutter, that you should not dive into their superficial stuttering behaviors until you have given them time and space to come to grips with their psychological reactions to their speech. It really is unnerving to have to even go for 5 minutes with stuttering. And you will find this absolutely when you do the so-called Delhi exercise, where you have to simulate stuttering to strangers. So if you look at your syllabus, look at that assignment, I want you to simulate for 5 minutes, that's all, atypical disfluencies, such as prolongations, sound syllable repetitions, tense pauses if you can simulate that. And I just want you to have a feeling even if it's for 5 minutes, of what stutterers go through every day in their lives. Okay, it is really very humbling to have to stutter in front of people. And it's very humbling to, even if you want a cheeseburger and you can't say the word cheese, to order something else, just so that you don't stutter. So that second clause of what Van Riper wrote is very, very important for therapy. That is the stutterer's reactions to himself, his speech, and also watching the reactions of others as they, listen to them talk. Okay? So now the next disorder is quite different. We don't know whether they're cousins, first cousin, second cousin, or what. That is the relationship between stuttering and the second disorder called cluttering. Okay? I have literally spent the last 30 years of my life trying to understand what cluttering is. And just a little footnote here, 2 years ago in Tour France, I was awarded the Des Eaux Weiss Award because of my work in cluttering, given by the Stuttering Foundation of America, as well as the International Cluttering Association. And if we think that if we think that stuttering is fascinating and complex, cluttering is tenfold more fascinating and even more complex. Why is it more complex? Well, in fact, cluttering has been known as a microcosm of many of our speech and language disorders. So, in other words, if you're working with a clutterer, that client will show you definitely articulation problems, rate problems, language problems, pragmatic issues, narrative issues, and so it's almost like a little laboratory of our whole field. And I guess this is why it was like love at first sight when I first heard about cluttering, sitting where you're sitting in my graduate course in fluency disorders. And so, however, if I were to give you one thing at this point in time that I feel is at the heart of cluttering, even though it has all these other disorders, it is that the person is speaking faster than they should, perhaps faster than their capacity. And you're saying, well, why in the world would anyone want to talk so fast that nobody can understand them and nobody can follow what they're saying? Okay? Well, think about ourselves. How many of you, if you were in front of me right now, raise your hand. How many of you tend to be a chronic speeder when you're driving? So yes, the posted mileage, mile per hour is 55, but you chronically go 70, if not a little bit faster. And it practically gives you pain to slow down to 60. Okay, so I'm saying, now why do you do that? And you probably say, well, I almost can't help it. This is just the way I'm wired. Okay, and yeah, you slow down when you see a patrol car, but then guess what? Once that patrol car is out of your sight, you step on the pedal again, and you go faster than you should. Okay, and so I'm beginning to think that people who clutter have a certain temperament. You know, we all have our pacing. You know, our heart has a pacer, but our temperament has a pacer. So you know what your pacing is like as soon as you see and you interact with someone who contrasts with you. And I'm wondering sometimes whether it's easier for a fast-paced person to slow down or for a slower person to quicken one's pace to keep up with your wife or your girlfriend or boyfriend. So has to do, I think a major piece of cluttering is that the person is speaking faster than they can. Okay? So what I want you to do now, if you can pause on this YouTube, is to say a tongue twister like Peter Pipe. I don't know, since I wasn't brought up in this country, I don't know some of these. She sells seashells at the seashore. She sells seashells at the seashore. Okay, I'm going to simulate it, and I'm your conductor, and I want you to, when I go like this, mean faster and faster and faster, and I want you to reflect meta, what goes on, what are the kinds of disintegration that goes in, happens when you go faster and faster to the point where you exceed your threshold, you exceed your max. Okay, she sells seashells at the seashore. 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 She sells seashells. Okay, what happened? Okay, you can talk to yourself. No one else is in the room. Probably you're saying that, well, my articulation disintegrated. I dropped out syllables. I dropped words. I even lose track of what the next word is. So when we exceed our capacity, we have disintegration at multiple levels. Now, another symptom is typical disfluencies. So that is perhaps a differential diagnostic point between stuttering and cluttering. That is, that cluttering is exemplified primarily by typical disfluencies. So so for example, incomplete phrases followed by revisions. I want vanilla. I want vanilla. No, chocolate. No, never mind. I want strawberry ice cream. Okay, so all these what linguists call linguistic maze behaviors. Okay, it's like the message is not straightforward. It's a maze. It meanders. It's a maze. Okay, so that's why we call them maze behaviors, comprised mostly of typical disfluencies. However, once in a while you do get some sound repetitions and syllable repetitions, but by and large, the disfluencies of a pure clutterer does not involve physiological effortfulness. In fact, they're just too fluid, too ongoing, to the point that they are just going too fast. Okay? So, speaking about that, then, indeed, their rate is fast. But now I'm going to use another idea here, which is that it's irregular rate. Now, can you think about what might result in irregular rate? Well, one very, very important ingredient for that is when you pause at inappropriate places. Okay? And you could even, your actual rate could be slow, but if you pause at irregular places or inappropriate places, then it's perceived as jerky or irregular. Okay, so I pledge allegiance to the flag of the United States of America. That gave you the impression, the perception that it was irregular. And this is what we hear from people who clutter. As if you don't have your hands full enough already, if you're working with your first clutterer. Many people who clutter are not good at self-monitoring. Now here I want to talk a little bit about maybe the difference between awareness and monitoring. Maybe a good metaphor or analogy here is that, let's say you're trying to lose weight, okay, and you are aware that you sometimes snack between meals, okay, but you've got an exam coming up, and you're all tense, and you're aware that there's a bag of chips in the kitchen. So you feed yourself chips, okay? Though you are aware that you really should not snack on chips between meals, okay? But you still do it, and you barely even monitor yourself, okay, because you're so revved up in terms of studying for your midterm. And so there's a difference between awareness and then the ability to actually monitor your behavior as you're doing it. Okay? So at least it is the case that many people who clutter have poor self-monitoring and online monitoring. That is, as they're in the process of speaking online, okay, in other words, as you're speaking, they don't monitor themselves, okay? They don't even sometimes monitor the fact that their listener is making these frowns and these faces, this frozen face that they can't understand and follow what they're saying. So, self-monitoring. Now, a term that may be new to you is over-co-articulation. Over-co-articulation. You learned what co-articulation is. It's like, has to do with the transition, the formants and such between one segment of speech to the next, okay? But over-co-articulation is that you actually will delete sounds and syllables. Or another symptom of over-co-articulation is vowel neutralization. Okay, so an example of over-co-articulation is, instead of saying telephone, it's telephone. Okay, what did I do there? I deleted the unstressed syllable. Okay, or you could call it weak syllable deletion. Okay, or if I wanted to say sort of, and I say it very fast, I neutralize that vowel and I say sort of. Okay, telescope becomes tescope. So you try it. Telescope, tescope. Sort of. Telephone, telephone. Okay, so ironically, I have found that using the names of the various phonological processes are very helpful. However, do not mistake that for the fact that this person has a phonological problem. It's not a phonological problem per se. It's just that, the misarticulations are not phoneme specific. It transcends phonemes because the fast rate transcends, it can impinge on every, various sounds and syllables. So therefore it's not phoneme specific. If it were, then it would be an articulation problem. That's not to say that a clutterer can't also have a phoneme specific articulation problem in addition to their cluttering. Okay? So again, over-co-articulation has to do with the fact of talking so fast that there are weak syllable deletions, cluster reductions, final consonant deletions, vowel neutralization. And the reason I use the word neutralization is that typically in phonetics you learn that there is the high back vowel, low front vowel, low back vowel, high front vowel. Well, you're going so fast that you can't modulate your tongue enough so that you can make the vowels distinctly. Okay, so another aspect of cluttering something that I learned very much from my clients is that they say, you know what, Dr. Myers, I think the reason I clutter is that my mind is filled and bombarded with thoughts. And someone by the name of Joseph Dewey, who founded the chat group for clutterers, said that, it's like his brain has lightning flashes, so multiple thoughts coming through. And the problem is that people who clutter don't stop to organize their thinking. You and I, we know when, come on in. I have this, and one student here, right? No, she's actually helped. Oh, two. Hi. Hi. Now we have students here. All right. I'm not going to take attendance. So people who clutter then will say that I have so many thoughts coming to my mind, and I don't organize my thinking, I don't sequence them, and I just keep on talking. Okay, I can't shut my mind off and I can't shut my mouth off. And in fact, at the first International Cluttering Association Congress that I helped to organize in Bulgaria, Helene from Norway, who's very active in ICA, said that she was almost in tears because she said, Dr. Myers, even when I go to bed, I can't turn off my thoughts. Okay, so I'm just curious whether any of you, I don't know, whatever you caught here, are you like that or not?
Yeah, I have that problem a lot.
That you just really can't turn off your thinking?
Mm-hmm. Yeah. Yes. Sometimes your body is completely exhausted, but your mind just keeps going and going.
Yeah, always something.
What else can you say about that? But at least you organize your thinking, right?
Yeah, and usually it's work. Usually when I'm up because I can't sleep, it's because I'm trying to work out maybe a problem that I've had.
Yeah. Okay.
So.
What about you?
Yeah, I agree too. It's always like, I feel like there's always something I could be thinking about, something that has to be worked out. Something. Yeah.
So you literally can't turn it off.
No.
Mm-hmm.
It's not voluntary, it just keeps bombarding you.
Yeah.
Mm-hmm.
And in fact, I can relate to that because I was worried about the snow maybe next week, because this will be the third Monday.
Right.
And I was told you I was thinking about bringing my sleeping bag to High Weinberg. And then I thought, well, what if the patrolman kicks me out or say, what are you doing?
I'm staying for the night.
So anyway, so even people who don't clutter can, relate to this idea of not being able to shut off your thinking. Well, guess what? People who clutter, this is a chronic state for them. Moreover, their problem is, I really think that they have issues with their executive functions, that the way that we use the term. And so they have difficulty in organizing. The problem is they keep on talking anyway. So that is a major issue here. Another area that they are likely to have problems with is that they have problems in organizing their narratives. Obviously, if your brain is bombarded by multiple thoughts that are coming to your mind, unorganized, and you keep talking anyway, your narratives are going to be lacking in coherency and cohesiveness. And therefore, people don't know what they're talking about. So this is, you have your handful when you're working with someone who clutters. So before we conclude this section, because I really want you to think about fluency in its broad-based level, the infrastructure, I want you to, after you leave this unit, I want you to come up with your own clinical insights about fluency and rate as it might apply not only to stuttering and cluttering, which I just covered at an introductory level, but also what about your Parkinson's patients? We know that they take L-DOPA, helps them pacing. What is the behavior? What are the symptoms relating to fluency and rate for Parkinson's? What about the LD child who has learning disabilities? What about your dysarthric patient? Is that the same or not as, let's say, the patient with apraxia? And then finally, what about the child with Down syndrome? Don't they also have issues with fluency and rate? So it would be really great when we meet, which hopefully will be very soon, if you could jot down your insights, your conjectures about the fluency behaviors and rate behaviors of these other disorders, and then we'll pool our insights when we get together. Okay, so we'll see you next time.